Bun găsit! Traversăm o perioadă plină de incertitudini în ceea ce privește sănătatea noastră și a celor din jur. Pandemia și efectele sale ne-au pus pe toți în fața unei noi realități, dar cancerul există în continuare. Așa că astăzi vă propun să vorbim despre afecțiunile oncologice feminine. România ocupă primul loc în Europa ca incidența cancerului de col uterin, 9 femei fiind diagnosticate zilnic. Austria este de câțiva ani una dintre principalele destinații medicale pentru români, tocmai de aceea astăzi stau de vorbă cu Profesor Doctor Christian Kainz, specialist în obstetrică și ginecologie la Dobling Private Hospital din rețeaua clinicilor austriece PremiQaMed. Hello, I'm glad we have this discussion today.
Hello.
Professor Kainz, you have been a medical director of the Dobling Private Hospital in the affiliated outpatient clinic. How has the hospital developed since then?
So I have been here in the private hospital, Private Clinic Dobling, since 2001. The hospital has developed in many ways. On one hand, it expanded in space, and it's today the largest private hospital in Austria. And on the other hand, it has expanded to include many facilities and specialist areas. And today it offers a very wide range of medical services at various levels.
A slogan of the Dobling Private Hospital is everything under one roof. What does this mean for patients?
This means that we want to offer the patient a maximum of medical services under one roof. That means not only inpatient treatment in the private hospital, but also outpatient examinations and treatments in our outpatient clinic and in our doctor centers, where we have also physical medicine and rehabilitation. That means that from simple consultation, for example, at the doctor center, to high-tech diagnostics, comprehensive preventive programs, complex surgical procedures, and also postoperative rehabilitation and physiotherapy is offered, and the patient can receive everything here in our hospital.
Mm-hmm. Well, what is crucial for successful treatment?
Of course, the medical infrastructure is very important, but of course, it's most important that there are good doctors who make the success. Our hospital works with very well-known specialists, and many of them are involved in research projects or work at the university hospital and have international experience. The specialists of different disciplines work in close cooperation with each other, and good cooperation between the different disciplines is becoming more and more important in our days because medicine is becoming more and more complex.
How could one describe the procedure when a Romanian patient asks for a problem in the PK Dobling?
We receive most of our inquiries by email, either directly to the clinic or to our international desks, which is a service department of the hospital for international patients, in which Romanian-speaking staff also works and process inquiries from the international patients. Based on the medical findings we receive, then a suitable specialist is selected who can take over the case. And this doctor analyzes the case and makes the treatment proposal based on which a cost estimate is prepared. This is usually possible within 2 days. There are no long waiting times, and we have a very flexible organization, so you can get appointments for treatments and surgeries in one time.
PK Dobling is well known for women's health and offers the best care for all medical issues in a woman's life. What are the areas?
For women's life, our offer includes obstetrics, in vitro fertilization, state-of-the-art treatment methods in the safe setting of a clinic, and discreet and an upscale atmosphere with a very high success rate for assisted reproduction. Prevention for women, that means early detection of different diseases, also oncological diseases. Gynecology and gynecologic surgery, modern and minimal invasive surgical methods are offered. Breast health, in our breast health clinic, early detection with modern techniques and also including magnetic resonance imaging is available, and new treatments for breast cancer are offered. And in this setting, in most cases, organ preserving and very good cosmetic result can be offered.
The obstetric department of PK Dobling was voted the best obstetric department in the country. What make it stand out?
Our obstetrics department has been voted the best in the country in an independent research project. The aim is to offer the woman as much freedom as possible with a maximum of security. Together with the woman, it is decided how she wants to bring her child into the world, how she wants to deliver, and we try to fulfill her personal wishes as much as possible. If the woman wants natural birth, she has an excellent midwife which is taking care of her. And it is also possible for her, if she wants to have, for different reasons, a cesarean section, she can also have this. The father of the child is, of course, welcome to be present at the event. And also during a cesarean section, the whole family can be together. And in doing so, we offer the young families an atmosphere in which they can feel safe and comfortable and secure.
Preventive medicine is very important in the private hospital Dobling. What is your recommendation?
So prevention starts with a healthy lifestyle, and it is supplemented by regular preventive examinations and visits. In the investigations, it is most important to select the right studies in order to really generate the benefit and avoid damage. This is ensured by high quality program and our modern equipment. On the other hand, there are ready-made preventive modules which have been created on the basis of the current medical knowledge. And on the other hand, individual examination programs based on the individual situation and the history of the patients can also be created for certain medical questions or issues.
What should be the preventive measures for a woman?
In addition to an accurate history of the patient and a clinical examination, the vaginal ultrasound and the pap smear and the hormone status, if necessary, should be made. In addition, we recommend testing for the human papillomavirus if it is necessary. And based on the situation of the patient, we recommend a human papillomavirus vaccination. From the age of 40 or 45, based on the family history of the patient, the breast should also be examined by mammography and ultrasound once a year or every second year.
Breast cancer is an issue that scares many women. However, great progress has been made in the treatment. What has made this possible?
In recent years, new methods and new drugs have been established in the field of the treatment of breast cancer. In addition to the central objective of oncological safety, the preservation of the breast and the reduction of side effects are central concerns today. However, the success of the treatment has also to do with the fact that specialists from different disciplines the gynecologists, maybe a plastic surgeon, the oncologist work closely together and jointly develop a treatment plan individually designed for each patient to have the maximum security and the least side effects.
Is there an example of a patient from Romania that you have been particularly reminded of?
Yes, there was a young patient who should have the uterus removed because of a carcinoma of the cervix. And after careful testing and examinations, we were able to cure the patient with a minimal invasive surgery, and she was able to continue to have children and to get pregnant.
The last question, what are the medical problems for which a patient from Romania address Dobling Private Hospital?
Patients from Romania address us primarily with diagnostic questions, oncological, gynecological, orthopedic, and surgical topics. There are also requests for a second opinion. That means people want to have their diagnosis checked by our specialists, and we offer these in various areas. For cancer cases, for example, patients can have their diagnosis checked by an experienced team of specialists in the tumor board and also receive an individual therapy. The second opinion can be made on the site of the clinic as well as from distance.
Okay.
And at the moment, there are strict travel, some restrictions for traveling in connection with COVID-19. But we have always a good way for them to consult us or, if necessary, to come to our clinic.
And these are my questions. Thank you very much, Professor.
Thank you very much.
Înainte să închei, vă reamintesc că găsiți detalii despre cum puteți contacta echipa de specialiști în oncologie PremiQaMed în articolul care va fi publicat în curând pe adevarul.ro și click.ro cu precizarea că echipa de contact răspunde și în limba română întrebărilor sau diferitelor solicitări.